Thank you so much for joining us today. My name is Jason Maganoy. I am the publisher of Maclean's, and this is a new initiative we have called Maclean's First Person. And basically, what it is we speak to leaders across Canada, and we talk to them about Canada. Today, I'm with Dr. Eileen Davila, Medical Officer of Health for the City of Toronto, and we're going to be talking about a lot of things. But first off, I want to just say thank you so much for taking the time and joining us.
Well, thank you, Jason, for giving me this opportunity to chat with you.
So, one of the things that we're so the pandemic just happened. It literally just happened. And I think that one of the things that I'm noticing is that it's really hard for us to reflect. It's really hard for us to reflect. It's really hard for us to look back at that time. The only time I personally that I ever engage with it is like when I'm looking at my Facebook memories, and I forgot that that was happening to me. So what we're going to do today is we're gonna reflect and hopefully hear about some of your experiences as the medical officer of health leading Toronto Public Health during this crisis. But my first question is, reflecting on the pandemic, what are the key lessons that you believe we have learned about public health preparedness in urban settings?
Wow, Jason, there's a lot in that question, isn't there? And thinking back to how you started, you said the pandemic just happened. It is still really fresh, right? It is still really fresh. Certainly for those of us in public health, and I would dare say for the entire health system, um, we're still, living many of the circumstances that emerged through the pandemic and have persisted even as the most acute, phase of the response has faded into the pages of history. So you're quite right. Reflection is perhaps something that we're not always the best at as humans, but it is really important. And I think you're speaking to the importance of actually trying to get the most of the lessons learned from the experience, considering how significant a period this was in our lives. So, let's look back at what I think we've learned and what we have come to appreciate, I hope, more as a result of our COVID experience. Um, in the urban setting when it comes to responses to other emergent issues. So when I think back on some aspects of the pandemic, we mobilized an entire city and all its resources. This is especially true for the health system, but it went far beyond public health or healthcare. It really was a whole of society response. And I think that if there is something that we should look back at with pride, it's that one, we're able to do it, and look at what we are able to achieve when we actually all pull in the same direction, when we're focused on a singular goal, and when we all put our resources towards that. I think that's incredibly powerful. And it's that kind of thinking, it's that kind of energy that I think we need to tap into when it comes to the next crisis or challenging situation that we run into as a city or as a global community writ large. So I think there's something really important there. I think there's something also really important in respect of how we are deepening our knowledge and hopefully getting better when it comes to things like communicating within the context of a crisis situation or risk communications. Now, there is always room for improvement on this. Don't get me wrong. Did we do things perfectly? When is it ever perfect, right? In
Yeah.
any endeavor. But are we getting better? Are we able to demonstrate that we're hearing, that we're observing what works and what doesn't work, and we're trying to improve with each one? I do hope that most people see that that was something that we were endeavoring to do. And I know that we're really committed here at Toronto Public Health to continuing to do. This is just, it's such an important component of that which we do in the realm of local public health communications. It's especially important within the context of a crisis or an emergent situation And I do hope that the public sees that while we were not perfect, I don't think there is such a thing as a perfect, response in the human endeavor. But I do hope that people see that we were constantly trying to improve and learn from the feedback we were receiving and learn from our experiences. I do
Mm.
also think that what was really important was we had the chance to really think about how we pull our resources, towards addressing a particular crisis situation and making sure that we actually all had to learn different things. When you are faced with a crisis or a situation that requires that level of response, by definition, you're going to be pulling resources in to do things that they don't normally do on a regular basis. And I would say that within the realm of public health and arguably in healthcare as well, that's often approached with a little bit of trepidation or concern. But, when the chips were down, people stepped up and they took on tasks and assignments and roles that they had never imagined themselves doing, that they didn't think that they could do, and they were able to do. So when I think about, what are the good things that we've learned? What are the lessons we've learned from our experience this last few years? Those are some of the things that come to mind. Um,
Wow.
there are also areas for improvement, and I'm hoping we're going to talk about that too.
Yes, like because my it was funny because like there's I have this like dual memory of everyone, like there were so many heroes, like there was just so much heroism during the time. And then on the flip side, I also remembered not being able to access a vaccine for a long time and trying to rely on the vax hunters and literally like you're number 9 million in this queue. So my question is, you would hope that after you go through a process like this, that you've learned your lesson, we're ready to roll. So where have we improved in terms of like our pandemic response? So like are we ready for the next for the next health crisis? And then on the flip side, conversely, what stayed the same? Like where have we sort of been stuck in the mud and not improved in quite yet?
Well, there's so many things in that, Jason. So where have we improved? As I said, we've seen people, stretch themselves. So we know that we have this real valuable asset, certainly within the realm of public health. I look at the people of public health as a significant resource and a major asset that we have in our favor. Um, really passionate, very skilled people who are ready to step up and did step up in the context of COVID. As I said, often doing things that they had never, done before, but they were trained and learned how to do and did the very best they could to make sure that we were providing, the best response that was humanly possible at that time. Are there things that we need to work on? Absolutely. So when I think about the kinds of things that we've seen, and we've seen recent federal reports in respect of how might we improve our response, how might we improve the availability of science advice. Um, there are lots of reports that look at these kinds of things. But when I think about what we can really do and what might resonate with people who are listening to our conversation, here are a couple of things that I think about. One, we know that we need good data systems to support our ability as public health and for our healthcare partners as well to be able to understand what's happening within the context of community, who's getting sick, who's able to access vaccine, who's being able to take advantage of the resources that are available, the treatments that are available, et cetera. And how do we do that in a very nuanced way so that we can understand whether it's on a geographic basis, whether it's on a socio-demographic basis, where is the response working well, where is it not working well? But those systems have to be in place and functioning well, not just at the moment of the emergency or the crisis, but you actually need those all the time. I think that brings me to my second point, which is that at the end of the day, the ability of any community, whether it's an urban center like ours or a small town or an entire country. The ability of any community to actually be resilient in the face of a major challenge like a pandemic depends on how healthy they are to begin with in the first place. So when I think about this from a public health perspective, right, we're all about prevention and population level interventions. So the healthier we are as a community before the crisis hits, the more likely we are to be able to actually manage and weather that crisis well. So this gets at all the things that public health speaks of. And frankly, those things serve us well, whether we're talking about a pandemic or whether we're talking about an in-between pandemic period. So, and this all comes down to the social determinants of health. These are the things that actually drive good health within a community. So we're talking about housing, we're talking about income, we're talking about education, we're talking about air quality, water quality, social connectedness, the sense of belonging, all these things, the ability for people to actually really reach their full potential in terms of their health. The more people are actually able to really reach their full potential, the better we're going to be as a community, the better we're going to make it through whatever the challenge is. So to my mind, that's what really counts. So of course, a pandemic response is important. Just as important to my mind is what we do in the in-between periods to make sure that our community is as healthy as it can be, and that health experience, that health status is as equitable as it can be.
Wow. So like this idea of improving the city is it sounds like it's a really important prerequisite for the health outcome and also for our preparedness for a pandemic. But I was sort of seeing some things in the news, like that really great housing project that UHN is doing, and that seemed to be a really phenomenal sort of outside of the box way of thinking. Can you share some examples of collaborations between the city departments and health organizations that emerged during the pandemic that you were super proud of?
Yeah. And you know what, Jason? How long have you got? There were lots of these things. And I think that one of the lessons learned that perhaps I didn't get at, in an earlier response, the health challenges that people are facing today, the situations that we're addressing in our world today are incredibly complex. They are not simple or straightforward. So I think in terms of, if we're to address those situations well, what that means is that you actually need strong partnerships and collaborations because the health challenges we face today are so multidimensional, right? So traditionally, hospitals have focused on, restoring people who are in ill health or addressing, disease and treating it. The reality is that, you can't really treat disease well without taking into consideration the circumstances within which that disease occurs. So people are able to better participate in their treatment, and this is outside of the realm of public health, but important. If you're sick, it's much easier to be able to participate in your treatment and to get to the desired health outcomes if you are stably housed, if your income is stable and secure, if you have supports around you, a supportive network to help you navigate the challenges of what it is to be ill. And those are just a few examples. So when we think about what it takes to actually make an entire city experience good health and to reduce inequities in health status, it's going to take that kind of collaborative partnership across many different sectors and within the health sector. So when I look back at the pandemic experience, certainly one of the highlights, if you will, was the fact that we did have the city's largest vaccination campaign in our history. Almost 9 million doses given in 2021, 2022, and 2023. And never before has that happened. And that would not have been achieved had it not been for the incredible partnership between, us at Toronto Public Health, our healthcare partners, acute care hospitals, uh, primary care providers, pharmacies, uh, community agencies, clinics all over the city, and some other agencies who are perhaps not healthcare, but we're actually actively participating in, our community ambassador initiatives or our vaccine engagement teams. That's what actually allowed us to lift up that incredibly huge effort that gave us the results that we saw, right? We had, world leading rates when it came to vaccinations. And it actually did help us a great deal in terms of being able to protect the people of Toronto against COVID-19.
So hearing about just the ways that we had come together over the course of the pandemic, on the opposite end of that though, like it felt like there was a lot of division as well. Like I pretty divisive time, at least according to my Facebook memories, a very divisive time as well. And one of the things that emerged in the division was this idea of vaccine hesitancy. Like it remains a really big challenge. So what strategies do you recommend for building trust in vaccines and other public health tools to just, again, continually improve in our response to things like the pandemic?
So I think you're quite right around the divisiveness of our times. And I think it's important to look at that in context first. Uh, my observation is that we were already seeing divisiveness in society pre-COVID. Unfortunately, COVID and the way it became very politicized, unfortunately, I think fueled even more divisiveness. So it was already there to begin with. Unfortunately, the advent of the pandemic didn't help. And we continue to see uh, persistent divisiveness and politicization of, what are actually scientific issues. There is an evidence base in respect of COVID-19 and other infectious diseases. Unfortunately, that does seem to have been caught up in a lot of the political divisiveness, I should say, of our time. So, how do we address that? Well, first and foremost, it has to do with communications. Um, and it's communications through every imaginable channel, using language that is accessible and resonates with audiences, the audience that we're trying to reach. And sometimes it means actually stepping back and letting others who already have a developed relationship of trust be the first speaker, right, on the issue, and to afford that bit, what I would call a bit of a proxy of trust, right? You don't know me, but you know this person, and they know me, and they trust what we're providing in terms of scientific advice. I think things like that do make a difference. I also think that it's really important that those conversations, right? Conversations that are specific to you and your health or the health of your family, those kinds of conversations and discussions best happen in person, one on one, with somebody who actually knows you and your health. So again, I don't think we can forget the role of primary care providers, trusted healthcare providers with whom you actually have a face-to-face and direct relationship. They can actually speak to your individual circumstances or to one's family's, very specific circumstances in a way that broad-based communications like we do in public health simply can't touch. We're just not at that level. So from a public health perspective, how do we enhance our efforts? Certainly being as straightforward and clear as we can be, using multiple channels, making sure that we're accessible and that the advice we're providing is accessible in a variety of languages and in a variety of formats that reach a broad range of audiences, each of whom may have different abilities and different ways of accessing information. But I think also fundamentally from a perspective of trust in government agencies, and we are as local public health, part of a government agency. I think the more we are every single day able to make good on our obligations to the public, the more we are able to make good on the promises that we make to the public, the more we're able to make good on our obligation to improve the health status of the public, to reduce inequities, and to actually make people feel that this is a good place to live, then the more trusted we will be when it comes to any communications, whether it's in respect of a vaccine or some other public health intervention in the context of a crisis or an emergency, or in the situation where we're just doing everyday public health work. I think that's a really important component, that we deliver on our obligation and on our promise to our public.
One of the things that happened during the pandemic also was we had this cover in Toronto Life, and it was like, everyone is, staying at home, and it was a shot of a condo building, and just all the lights are on, and everyone is in there, and um, it seemed pretty lonely. And I think too, like one of the things that emerged over the course of the pandemic was this idea of, ooh, Toronto's a pretty lonely city. Lonely is becoming a bit of a crisis in the city, and the pandemic kind of has been a starting point for that. And then as we've emerged, it's harder for people to connect again. Like it's been harder to sort of rebuild some of those bonds that we have in our community. So my question is, how has the pandemic influenced the way we approach mental health services in Toronto? And have we improved when it comes to mental health in terms of a public framework in Toronto?
So, yeah, when it comes to mental health, there's no question. COVID-19, the whole pandemic, we did see a worsening in respect of mental health status. Um, I do think that when you look at the data very carefully, even pre-COVID, we were beginning to see a worsening of mental health status. And the concept of loneliness, or the need for better social connection in our city, and the impact that loneliness and the lack of connection, or not enough of a sense of belonging in the city, was something that we saw even before COVID. But there's no question. I think when you look at the numbers, and we look at whether it's surveys on self-reported mental health, we saw that things worsened over the course of the pandemic period. And we now have to figure out together, how best do we actually address this? The interesting thing here, Jason, is that there is still a lot that we are learning as a society on how do we manage, how do we promote better social connection? How do we foster more of a sense of community when we do very much live in an era of social media, right? This is a relatively new technology, cellular phones, spending our time on screens, or interacting with each other through social media. There's lots of literature on that now. The challenge is, okay, so how do we live better with these technologies? So that we, clearly they're parts of our lives. How do we find the right balance between the convenience, while at the same that's afforded to us by these technologies, but at the same time, how do we foster a sense of social connection? And there are people who are working on this now. Certainly, from our perspective at Toronto Public Health, we just initiated a strategy last year called Our Health, Our City. And it is a whole city strategy in respect of mental health, and as well with respect to substance use and addiction, and all the many challenges that are associated with optimizing mental health and addressing mental illness in our community. So we do know that it's like many things in the realm of public health, it's not really left to one single party to solve, right? What's really required is a whole of community response. And,
Mm.
it can be simple things like actually taking the time to say to hello to people on the street. It starts off often with simple things like that and goes all the way to policy endeavors that create environments that actually allow for people to interact with each other more. And that happens within the context of city planning, for example. It happens within the context of what happens in our parks, forestry, and recreation division, how they, develop new parks and create strategies that actually foster more interaction between people. It goes all the way to provincial policy on education and what happens within the context of schools. And oftentimes it has to do with programs that seem like they're way outside of mental health, but actually have significant mental health impact. For example, school nutrition programs, right? The more we're able to actually support access to food within schools for children, not only does that improve their nutritional status and their physical health status, but when you have kids eating together, sharing a meal with each other, with their classmates, that actually improves their health. It improves their academics, their ability to actually concentrate and pay attention in school. And when done well, also creates for the opportunity for socializing across, all levels of income, across different grades even. And think about how powerful that is from a mental health perspective, from a sense of belonging, from feeling like you actually have a support network. So these are the kinds of things that we're looking at and that are articulated in our strategy amongst many others. But it's a lot of work, but it's well worth it. And again, not something that we do alone, but yet another example of what we do in collaboration with partners throughout the health sector and beyond.
What final thoughts or advice would you offer to your successor regarding, future pandemic preparedness and public health strategy?
So, to my successor, what advice would I offer? Well, first and foremost, I would make sure that they fully appreciate that they have a remarkable team here at Toronto Public Health. I've had the honor and privilege of leading this team for the last almost 8 years. And that included leading the organization through what I would argue are some of the most challenging years that we've had to come through in the 140 years of this organization. And what I saw was, the incredible passion that the team has here, the incredible skills that the team brings to bear on every issue, and the real humanity and caring that just permeates the entire team here at Toronto Public Health. So first and foremost, it's almost as if they don't really need any advice because they have a heck of a lot of resource right here in the organization that they should rely upon, and know that they will be in good hands. So I think that's my first little piece of advice. I think the next thing I would say is that, look, what makes for good public health in the context of an emergency or a crisis situation is it actually looks a lot like what constitutes good public health in the non-emergency situation or in the in-between period. And really what that is, it's around a focus on delivering on behalf of the public, right? Making sure that what we're doing is constantly delivering evidence-informed interventions that will actually improve health and reduce inequities. If that's your guiding North Star, you're golden as far as I'm concerned, right? That's really what it boils down to. And for me, there's a real imperative to actually deliver on that. Because when I think about COVID and I think about the pandemic, I think that we have to remember that, as much as there was success, right? Largest vaccination campaign in the history of the city. We did manage to protect thousands and thousands of people, right? From the worst that COVID could deliver. But there was lots of loss too, right? Thousands of people lost their lives, and thousands continue to live with the effects of long COVID. And, countless people lost their livelihoods and had real challenges as a result of, the havoc that COVID wreaked. So, to my mind, if we're to honor that, right, and show that we're really learning from those experiences, to honor those losses, then we really have to deliver on evidence-informed interventions that truly improve the health status, that protect and promote the health of our city, and that do so in a manner that actually enhances and really supports true health equity. That's where I think, I would advise the next medical officer of health to go, and to use that as their guiding North Star.
That is a great way to end this discussion. But Dr. Davila, thank you so much for joining us today. And yeah, I mean, obviously, I was even chatting with you today and just thinking about, like, just even reflecting for a bit, and also thinking about things that we gained, but also the things that we lost. I think it's just really incredibly important that we do that. And hopefully, when we know it's probably going to come again, next time, we'll be even more prepared. But thank you again for taking the time.